For the sake of those watching, I want to relate personally that Dr. Choukas-Bradley and Dr. Kinghorn are professionally and personally passionate about improving mental health awareness and treatment of mental health in college students. I'm honestly thrilled to be joining the discussion tonight as just the moderator. And I want to say a sincere thank you to both Dr. Choukas-Bradley and Dr. Kinghorn for joining this discussion tonight and bringing their perspectives and passion to the discussion that we'll be having. I really am glad y'all are here. Thank you for coming. To start us out, I would really like to hear and get to share with the audience more about your individual experiences in mental health. If you are, would you be willing to tell us a little bit about what's motivated you to pursue this type of work? Let's start off with Dr. Choukas-Bradley. Why don't you get us started?
Wonderful. Thank you so much, Dr. Gable, for moderating this discussion. And thank you so much to Veritas for inviting us to speak. So I became passionate about entering the field of clinical psychology and understanding how we can ameliorate mental health challenges when I myself was an adolescent. And I observed that many adolescents, as they transition from childhood to the teen years, experience this sharp uptick in mental health concerns. And then that continues into the college years. So tonight, I know there are many college students with us, and college is a time when there are so many shifting responsibilities and roles and changes in one's identity and relationships that can create some really exciting, wonderful, joyful years and a lot of stress and challenges. And the same is true for different reasons, but similar challenges arise at that transition from childhood to adolescence earlier in life. And I became really passionate about understanding specifically the role of cultural and social factors. And I became increasingly interested in these topics, studying psychology at Brown as a college student, and then going into graduate school. And as time has gone on, I've become especially interested in a few specific areas. And I'll be talking about them, I imagine, throughout tonight in various ways. One is the role of social media. Social media, of course, affects all of our lives and the mental health of people of all ages. It can bring connection, especially during the pandemic when other forms of interpersonal communication aren't available. And it can create a lot of stress and increase mental health concerns. And I also am really passionate about understanding the roles of gender, sexuality, race, ethnicity, and how those identities intersect, and how experiences of oppression and discrimination can contribute to mental health concerns, as well as how people can develop values-aligned, balanced lives. And I do think there's a key role for spirituality in that we'll talk about tonight, and how developing, identifying one's true values and living a life in keeping with those values can protect against some of these mental health challenges we'll be talking about. So thank you so much for asking. That's a longer than I intended brief introduction, and then we'll talk more throughout tonight, and I'll turn it over to Dr. Kinghorn.
Thank you all for allowing me to join you tonight. I'm the visitor to UD, and it's really an honor to be with Dr. Choukas-Bradley and Dr. Gable, and really appreciate Kelly and Stephen and the planning team, and it's been really, really great to be part of this, and I'm really honored. I also just want to say thanks to those of you that came out. It's really hard to get Duke students out to anything this late in the semester, and so the fact that all of you who are on the call are here is really amazing, and I really appreciate that. And I know as we're going to talk about tonight that there's also just a lot going on in our world that relates to mental health, and just this week we're engaging another shooting of a Black man, Dante Wright, and there's just a lot that's happening. And I realize that these are not just kind of abstract issues, but they're things that are just all around us. And we all want to just acknowledge that tonight. This question, Dr. Gable, is just so interesting about how I got into mental health care and the question of worldview and background. And since this is a Veritas forum and we're going to talk some about faith and spirituality, it got me thinking about the fact that I grew up in upstate South Carolina in a pretty conservative Southern Baptist church. And I didn't have a strong experience of severe mental illness in my immediate family, but I did encounter it in a very close way at church. And that's where I had really upfront close experiences of being with people and relating to people with depression and anxiety and PTSD and substance use and engaging suicide and other things. And also at school and in my community and all around. And I think it was at church, I think I was in some ways encouraged to maybe distrust certain ways of thinking, but I was encouraged to trust science and psychology, actually, because it was like a way of, engaging human beings. And so when I went to college, as an undergraduate, I majored in psychology, and just thought that this is a way that I could help to learn about humans and how amazing and complex human beings are. I ended up going to medical school, not initially thinking that I was going to be a psychiatrist, but I ended up being drawn back to psychiatry because of all the medical disciplines. Psychiatry is the one where, like, your role is to engage a human being as a human being in all of their fullness, and that is something that I really have valued. And I found myself, we'll probably say more about this as the night goes on, but I found myself as a psychiatrist, still though wanting to resist ways that even psychiatry can sometimes treat people as machines rather than as full humans. And so even though psychiatrists don't do surgery and procedures as much as other physicians do, there are a lot of models of psychiatry where, like, you show up in a psychiatrist practice and you say you have certain symptoms, and the psychiatrist then says, well, here's a medication for these symptoms, and then you're gone, you come back in a few weeks. And there's good in that. And I want to just encourage the use of medication and other things, but I also want to say that we're whole human beings. And so how can we walk alongside each other, not as machines that need to be fixed, but as those on a journey who need to be accompanied and attended and cared for? And how do we think about mental health challenges in a broader context? And so that's where I find myself. And again, it's just such an honor to be here tonight. Thank you.
Thank you. I love hearing these perspectives. This is awesome. And Sophie, if I can just turn to you, and maybe if you want to address a little bit more about how your background and worldview and experience impact the way that you view the topic of mental health.
Yeah, absolutely. So I grew up closeted. I'm now out as a member of the LGBTQ community. I grew up in rural Maryland and did not have, I never heard of anyone being gay or bi or having any sort of sexual minority identity. And as I began to understand that I identify as queer, that was another factor. And it's a factor that's, personally related to my identity. And it is related to how I see the world. Living with a queer identity, like with any minoritized identity, brings a certain number of challenges and opportunities for unique perspectives and growth. And the experience of growing up queer and closeted and then coming out a bit later in life and getting married to my wife, through that process, I really thought a lot about how we make assumptions about other people and about what they have and haven't been through that often are not accurate. So for example, based on my gender presentation, no one has ever assumed that I identify as a queer woman. And that has made me really attuned to the idea that only through talking with people openly, and as Warren said, connecting on a human level, can we really understand people's experiences. And Warren, I'm so glad you brought up the most recent police shooting. My heart has been very heavy this week in light of the recent events. And over the past year, there have been so many troubling events that happen often far away from us. We see them on our phones and feel them very deeply. And something I've been thinking about a lot is how much I miss the ability to have these types of conversations in person and to connect with people in person and to get to hear those stories. That's what drew me to psychology, is the desire to talk with people, understand where they came from and how they developed the worldview they have, and how that then shapes the rest of their perceptions and experiences. And when people are suffering, how can we meet them where they're at? And use science, use psychology and psychiatry, but also, as you said so beautifully, Warren, make sure we're addressing the whole person, the true human being, not a machine. So there's a lot more to say, but I'll pause there and see if you have any specific follow-up questions about my background and experiences, Philip.
I'm really glad you shared that. No, thank you. And I think as we go through some of these questions, please bring those up, Warren and Sophie, as more just to hear about how your backgrounds and individual experiences intersect with what we're talking about here. I think that's really fascinating. I'd love to hear more. One of the things that you both talked about are these devastating events that are happening, and they're in our lives. We see them all the time, and they're in our or on our TV and on our phone, and we feel like we're living with them, and they're really impacting our college campuses. So maybe you would be willing to talk about, what do you think is happening on our college campuses? Like, what mental health challenges do you see among students that you interact with?
Yeah, thank you. We're going to tag team on this, and I'm going to take, I'm going to do the thing that maybe is worse to do on a Zoom evening webinar, and show some slides about mental health on college campuses before the pandemic. And then Sophie from her research or Dr. Choukas-Bradley from her research is going to share some slides about
Sophie is great.
mental health of students during the pandemic. Yeah, thanks. So I'm going to share a few slides here that are mostly taken from a semi-annual survey called the National College Health Assessment. My teaching at Duke is mostly with medical students and graduate students, especially divinity students. And certainly in the 10 years that I've been a faculty member at Duke, I've just walked with a lot of students who are dealing with just a huge amount of stress, depression and anxiety and other kinds of mental health challenges, and sometimes financial insecurity, and living with complex trauma and ongoing trauma. And so it's really made me appreciate just how much students often carry. And you see this in large data sets. And this is just one national survey. I don't know if UD is a participant in this, but many colleges and universities are. This gives a kind of a snapshot of how undergraduates and graduate students are experiencing their work and their lives. So just a few things. And I want you to notice both the numbers here and also the trends. And I think both are notable. This is a survey that has more recently changed its format in 2019 and asks about gender non-binary and other categories, but they only report male and female, so that's what you'll see in these lines. But look at these numbers, and this trends from 2009 until 2019, which is the last year that the items on the survey were the same. And when college students and graduate students are asked, have you ever felt very lonely? In 2019, 68% of women and 58% of men said yes to that. And you notice a slight uptrend in the maybe 6 or 7 years from 2013 on. Same way, another item, have you ever felt very sad? 75% of women and 61% of men said yes to that response over the last 12 months. These are lonely and sad are not clinical terms, they're just common experiences. And it's just notable how common these experiences are. And just everything we're going to talk about tonight is not just happening like somewhere out there to somebody who's answering surveys, but it's right here on this call. And so we want to just respect that this applies to you as well, to us as well on the call. And everything we're going to talk about is here in the room as well as outside of it. When we get to terms that are more kind of clinical diagnoses, you see even more of a trend upward here. So whereas 53% of women and 38% of men in 2009 were saying they had felt overwhelming anxiety in the last 12 months, 2019 that had gone up to 72% of women and 51% of men. Have you ever felt so depressed that it was difficult to function? You see here also just really high numbers. 48% of those who identified as women and 37% of those who identified as men. And then this is perhaps one of the most alarming things on this survey for me, the question, have you ever seriously considered suicide? And whereas in 2009, even this is a high number, 6% of all college students were saying that in the past 12 months they'd seriously considered suicide, but those numbers have been steadily climbing over the last 6 or 7 or 8 years. On this survey where the same items are asked to students every semester. And this is just, I think, significant. There's lots of possible reasons why this might be the case. Treatment seeking has also gone way up, which is both a marker of distress, but it's also a good thing that people are getting help. But you see here increases in the number of students who are seeking treatment for anxiety and an increasing number of students who are seeking treatment for depression. And so those are arguably good things, but they also are markers of the fact that there's a lot of students that are struggling and are having a hard time. And this is not an uncommon thing at all. And so if you're experiencing this, you're not alone. 1 out of 5 or 6 of your peers as students have also experienced the same thing in the last 12 months. I don't think there's any clear answers as to why there's this uptrend over the last several years, but it's certainly something that we've seen. I think Dr. Choukas-Bradley is going to talk more about possible contributions of social media, which I think is complex. Kind of depends on how social media is used. But also to the point of what we just were talking about this week, 2012 was when Trayvon Martin was killed, and 2014 was when Michael Brown died. And in the last several years, we've just seen enormous attention to injustices that have been longstanding, but have been right here with us, with racial injustice, with the Me Too movement, with Donald Trump's election, with general polarization of our society and culture, and increasing kind of people in echo chambers of conversation in different ways. And that's hard for everyone. And I think it is in some ways reflective of what's happening here. And also educational settings, like getting into college is harder, and education settings have sometimes become more competitive. And we'll talk more about that, I think, as we proceed. Sexual trauma is incredibly common on college campuses. So this is from the same survey. This shows different descriptions of unwanted sexual contact, but you can see that very high numbers of both males and females have identified having been the recipients of unwanted sexual contact in the previous 12 months. And that's absolutely contributing to some of the things that are seen. Dr. Choukas-Bradley is going to talk about mental health in the pandemic. I just wanted to say that there was this survey happened in fall 2019 and was given again in fall 2020. And what we see is largely students are doing about the same on this measure as they were before the pandemic, but with some changes. So some, I don't know, this may not be statistically significant, but some decrease in psychological well-being, about the same levels of thinking of suicide, but still at very high numbers, and loneliness. And then we see here a kind of maybe a slight uptrend still of, these are different items, but negative impact on class performance or progress toward degree due to anxiety or depression or stress. And so whether this is because of COVID but just because the trends of the last several years are continuing, it's hard to know from this instrument, but these are some of the things that we see. And I'm going to turn it over to Dr. Choukas-Bradley to take us into this year.
So I'll speak briefly about what we know about mental health during COVID-19 among young adults. As Warren was saying, we already were seeing this increase over time before the advent of COVID-19 and before this era of increased racial awareness and reckoning with racism in the US that we have seen in the past 11-ish months as well. But one thing that is really concerning to me is this set of data from the Centers for Disease Control and Prevention, which was done toward the beginning of the pandemic last June. So this wasn't just college students, it was US young adults broadly, 18 to 24. And so this is a representative survey, meaning it represents roughly the demographic makeup of the US in terms of race, ethnicity, socioeconomic status, gender, et cetera. And you'll see really high rates of mental distress among young adults at the beginning of the pandemic. And what's most concerning to me as a clinical psychologist is that a full quarter of respondents ages 18 to 24 said they had seriously considered suicide during this time. And you'll see that there were also very high rates of anxiety or depressive symptoms. So the 63% is if somebody had experienced anxiety and or depressive symptoms. Nearly a half of the respondents reported that they had symptoms related to trauma or major stress associated with COVID-19, and that about a quarter had started using a new substance or increased their substance use to cope. And, you know, I was heartened that the college survey, the national survey, what's the official name of it, Warren?
Yeah, National College Health Assessment.
Yeah, thank you. I was pleased to see that in fall 2020, the rates weren't substantially higher among college students than they had been before the pandemic. But what I hear from UD students anecdotally is that they perceive that they and their peers are experiencing increased distress, increased anxiety and depression. I certainly myself will disclose that I've experienced increased anxiety and depressive symptoms during the pandemic. This is a time when we are socially isolated in an unprecedented way and don't have our normal coping strategies related to social support and getting out into the world and engaging with the world in the ways we're used to. And I'll come back to that in a little bit. And these are more stats where you can see the change from August of 2020, this was another CDC survey, until just recently in January, February of 2021. And here you can see this further increase in symptoms of anxiety or depression in the past week. And then troublingly, an increase in the percent of people, young adults specifically, who said they needed but did not receive counseling or therapy during the past 4 weeks. So Dr. Kinghorn was mentioning that when you look at, rates of seeking treatment, that can be an indicator of mental health concerns, but also a positive indicator of people seeking treatment. But when people seek treatment and they can't find it, that's troubling. And please check out the resources we have for you. If you're interested in seeking treatment, UD does have resources for you to help you with that. I also want to note that we've just been bombarded by news coverage of how COVID-19 has affected mental health. And there's a lot of attention to mental health concerns among high school students and college-aged young adults. And you're probably familiar with all of this. And on the one hand, it's wonderful to have this coverage of this problem. And some students find that this bombardment of the message that depression and anxiety are rampant can increase the sense of distress as well. And so it's hard to find that right balance of reading about how troubling this time is, hearing about it, hearing talks like this where we're highlighting it, and taking a break from news and screens and disengaging from all this information. And, we've highlighted a number of times tonight and we'll continue to do so for students of color and for Black students in particular. The past year has been challenging on a number of different fronts, including this week. And more stories. I also want to highlight that for queer youth, adolescents and young adults, college age, high school age, are experiencing very high rates of mental health concerns during the pandemic. And it's really important to think about context here. You can imagine for LGBTQ plus individuals who are living in rural contexts or any context where they may not, as I did when I was a kid, may not know other queer people, may not have access to queer-friendly, supportive, affirmative resources wherever they're currently socially isolated. For many people, going to college could be an escape from an environment where one doesn't feel supported, that now is not available. And so it's not surprising that sexual and gender minority individuals are experiencing these high levels as well. But all young adults, it seems, are experiencing these increased levels. Although, as the national survey Dr. Kinghorn showed us suggests, it's unclear exactly how much these symptoms have increased. And certainly the pandemic has disproportionately affected people of color. And at a very basic level, we know that there are racial disparities in severe illness and death related to COVID-19, as well as experiences of racism and structural racism. So for example, limited access to healthcare, limited access to safe housing, loss of housing due to loss of job due to the pandemic. So there are these direct illness effects where the virus seems to be more deadly, for example, for Black or African American individuals in the US, and where indirectly people of color are affected more due to structural racism. And the CDC director just last week declared racism a serious public health threat. And that's part of my worldview, is thinking of racism and other forms of structural oppression and prejudice and discrimination as being public health threats, not just abstract ideas. And Meyer came up with this theory. I won't get too into theory. I know that's not why you're here on a Tuesday evening, but I just want to highlight that there is a lot of research from psychology about why individuals who have minoritized identities, people whose identities put them in the numerical minority in their context, why do they experience increased mental health concerns? And his theory was specifically developed for sexual minority people, but we can apply it in different ways to people of color, to people who identify as transgender with another gender minority identity. And what we know is that minority status can create these various forms of external stressors, such as directly experiencing discrimination or the structural barriers I mentioned, and internal minority stressors. So for example, for queer folks, internalized homophobia or transphobia, and those can impact mental health. But The pink boxes at the top show us that when people have access to social resources and individual resources that help them to cope, that can mitigate the effects of these minority stressors. And during COVID, it's harder for people to access those resources. And that'll be a big message tonight.
It's great to hear more about a big picture perspective, because all of us have our own experiences. And I'm really glad that y'all brought that up. You know, sometimes we think of mental health as something abstract or as a statistic, whether I'm struggling with it as an individual or it's something somebody else does. But Dr. Kinghorn, you brought up the idea that just loneliness and sadness are something that happens, that we're all experiencing, and we're experiencing greater levels during the pandemic. I'm glad you both touched on the effects of the pandemic. I think one of the things that I've been experiencing, and I'm sure folks in the audience would like to know, what do you think it is that's driving kind of these negative mental health experiences that we're having in the pandemic? And then do you think that might change the way, do you think the pandemic might have an effect on the way that we think about or discuss mental health like we're doing right now? Maybe Dr. Kinghorn, do you want to tackle that to begin with?
Yeah, I'm interested in hearing what Dr. Choukas-Bradley says to that from her research, but I would say maybe non-scientifically, but experientially, that everything in the pandemic feels about 30% harder in terms of the kind of intentionality, even connecting over Zoom and figuring out how to navigate. I also believe strongly that there are ways in which we buffer ourselves and gain a lot from just the ordinary ways of being together and eating together and being in spaces together and laughing together and sharing talk together. So if this forum, if I was with you at UD and we were all in the same room together, there would have been like a hub, there would have been a buzz in the room beforehand, and there'd be students talking to each other and, sharing experiences, and afterward we'd be able to gather, in a circle and talk. And that's just not available to us, and hasn't been available to us for the last year for the most part, in most ways. And I think there's just an enduring psychological cost to that. And then just to echo what Dr. Choukas-Bradley says, like, the pandemic is a disparity exposer and multiplier. So any form of disparity or injustice that was present in our society before COVID, and there are many, have become worse in the context of COVID, whether it's socioeconomic disparities, racial disparities, gender-based disparities. There's just a lot that's been exposed and exacerbated, and that means that the costs are also disparate among different communities. And I think we just have to be really aware of that.
Absolutely, beautifully said. And I'll add that the need to belong, the need to feel connected to other people, loved by other people, in relationship with other people, and to have status in human relationships, those are evolutionarily programmed needs. And there are so many studies from the field of psychology and from other fields on the effects of social isolation. I mean, being put in solitary confinement is considered one of the most torturous experiences a human being can have. And to provide one of the most famous examples of a psychology study that I imagine many but not all members of the audience are familiar with, I don't remember what decade it was done in, but long ago, there was a study to look at whether baby monkeys would prefer a wire monkey mother. So a monkey that was made out of wire, did not have any tactile comfort, no fur, but dispensed food and water. Did they prefer that monkey or the monkey mother that was cushy and warm, a stuffed animal type monkey, but did not provide any food or water? And the baby monkeys preferred that mother. And that study is one of the most famous examples of how human beings need that sense of love and comfort above many other needs. It's a very basic need. And depending on one's circumstances, people may live with families, but they might not be living in the situation they were in before the pandemic. That's true for many college students for whom this was a period of life when they had looked forward to leaving home. I know this isn't the case for all college students, but for many UD students leave home and live with peers and develop romantic relationships that may last a lifetime and explore their own identities and who they want to be and explore what they want to do in terms of careers. And to have that interrupted so suddenly, and to have many students move back with families, and many describe feeling like they're kind of regressing to their high school selves when they were just developing who they are. that's really hard. And for people who live alone in truly isolated circumstances and for whom all interactions are through Zoom or other video-based platforms or social media, that is an extreme challenge. And I was going to say something else that Warren, your comment made me think of. Maybe it'll come back to me as we continue chatting further.
Excellent point. Yeah, these are things that we're experiencing on an everyday level more intensely, as you're saying, through the pandemic. I really like that you touched on the idea of these just basic needs that we all have that are getting disrupted a lot of times during the situation that we're in right now. One of those kind of like basic perspectives that we all have is a different worldview, a lens that we use to see the world. And both of you have talked about specific worldviews that impact people's experience with mental health, people's experience with the pandemic. One of them that I just want to kind of bring around to our discussion is, do you believe we can find solutions to mental health problems from spirituality and religion? You both talked about how you've had perspectives on those. Can you talk a little bit more about your worldviews and how we experience the world, and then how that might influence your perspectives on mental health problems? I don't know who to pitch that question to first of all, so I'll let you guys decide.
Dr. Kinghorn, I would really like to hear what you have to say about this first, and then I'd love to share my views after.
Of course, sure. Yeah, thanks. Yeah. So thanks, Dr. Gable. I know we're getting close to the time when we want to do the Q&R, and so I think this is intended to take us into that. I wanted to talk a bit about this, but also just to offer some practical suggestions for engaging mental health on college campuses, because I think that otherwise it could seem like we're kind of skipping over some of these practical things to talk about faith and spirituality and religion. And I especially want to just, I'm assuming that many of you on the call, although not all, are maybe members of campus religious organizations or Christian groups or others. And I just want to encourage you in particular ways to address these questions that we're talking about. And then I'll talk maybe specifically about faith and religion from my perspective. I think one is just to acknowledge that these mental health challenges are present and real. Like, talking about things goes a really long way. And so looking for opportunities to name these realities in your small groups and in your meetings and in your conversations with people, and that makes people feel less alone, and that itself is healing. And there's resources out there that I could be open to talk about in the Q&A for helping with that. I think also just engaging with others with the knowledge that these issues are present and real. So if you're in a lecture hall with 100 people or a Zoom room with 100 people, knowing that 1 in 8 of those people that you're in this room with has seriously considered suicide in the last year might change the way that you talk about certain topics or address certain things or care for each other. And so just, and that's also the case with any church and any student organization or any, and so I think just being aware of that. Encourage help seeking and treatment seeking. So I just want to underscore, like, if you're wondering whether it's time to call the counseling center at UD or whether it's time to ask somebody for help, it almost certainly is. Like, if you're wondering about it, it means that it's time to get help. And so I just would encourage you to do that. And I know that there's people who want to help you and to walk with you. And then I would just say to last couple things before specifically talk about religion is to notice how shame is operating in yourself and in your community. I won't talk too much about shame, but just to say that shame is an emotion that we all feel that is largely based on a kind of, it corresponds to a kind of thought or belief that, like, I am not blank enough for this to be in good standing in this community. And therefore I ought to hide, or I ought to, blame myself or denigrate myself, or I ought to numb my emotions. And none of those are particularly healthy. And I think that faith can be really helpful in dealing with shame. But my experience of being in university settings is that universities run on shame, that there are ways in which shame just gets thrown around, both among students and also among faculty, that sometimes is the root of some of what we experience. And then related to that is to don't treat mental health challenges as only individual kinds of issues. They are individual issues. They happen in the brain. Medications can be life-saving, but they're not only individual issues. They also are ways that we sometimes feel things that are happening in our communities and in our culture. And we've talked about that some already. So insofar as there's a perception of a mental health crisis, it's not just that, like, there's people that are struggling, but what's in the community, what's in the culture that needs to change? And that can have any number of answers and any number of different levels, but it just encourages us to think ecologically about these questions also. It's okay if I say just a couple things about religion and spirituality. I do want to just speak specifically from a Christian theological perspective, because that's my background and it's like, you know, what I study and what I do. But I think that that faith communities, Christian communities, religious communities can be really helpful. I think it's also important to acknowledge they can be harmful. They can perpetuate shame, they can ostracize, they can stigmatize. And so how can we not have communities that are that way? But they can also be really powerful sites of knowing and being known. And so I would just say really briefly a few things that I think that that faith, maybe in general, but also specifically Christian faith, I think can offer to those who are part of these communities, and that those of you on the call that do identify as Christian or have Christian backgrounds might be able to draw from as resources for this. I think the main thing that I would say, and if nothing else that I say tonight sticks, it's that the deepest truth of who we are as human beings is that we are loved and known by God. And that is fundamental to who we are in a Christian context. That's the root of Christian faith, that God knows us and loves us and considers us good in a deep and fundamental way. And that's essential to anything else that comes. I think it's also that we're invited. Those of you that read the Bible, read scripture, know, if you read the Psalms, that we're invited not to like put on their best faces as if things are always good and we can't talk about our struggles, but scripture itself invites us to bring our struggles into prayer with God and into the life of God. And I sometimes go to Psalm 13, if you're looking for a psalm, where the psalmist is like, how long, O Lord, will you forget me forever? How long will you hide your face from me? How long must I wrestle with my thoughts and every day have sorrow in my heart? And that sounds like a lot of what I hear from students and what I sometimes feel myself. And we're invited to bring that into God. So if you're feeling like depressed or anxious or living with history of trauma or other things, like bring that into the life of faith, not feel like you have to kind of leave it apart. I think also, you know, Jesus himself was one who, if you read the Bible closely, you can see that Jesus knew what it meant to bear the mark of being called mentally ill. There's this text in Mark, the Gospel of Mark, chapter 3, where Jesus was preaching in his hometown, and says that his family came out to restrain him because they said he'd gone out of his mind. There's ways in which Jesus himself knew what it was like to be stigmatized and to be ostracized, and certainly to suffer. And Christians believe that what Jesus experienced, the way that Jesus knows our struggles, means that those are brought into the very heart of God. And so you're not alone. And then the last thing I would just say is that we're invited as Christians to bring these struggles into community. That we're not to struggle alone. We're called to support each other and to walk with each other. And that is just really profoundly important, I think, not just for kind of helping us to bear our own challenges and sufferings, but also to give us a sense of mission and purpose, and to be called to live lives that are more and more characterized by love for God and love for these human beings all around us whom God has made, and love for the creation. And what does it mean to be called into a community that calls each other into a life of love like that? And that involves, I think, working toward justice. So it involves the kind of way to live that isn't a kind of simple recipe for mental health challenges, but is really important for thinking about just how we live and orient our lives. And that's pretty quick, but those are a few things that I wanted to offer.
Warren, thank you. Thank you for sharing that with us today. Appreciate that. Sophie, would you share with us a little bit more about your perspectives on mental health and your worldviews religiously and spiritually?
Yeah. Warren, that was very moving to me. And something that I'm really struck by right now, as I have been in the past, is while I don't identify as a Christian or with any organized religion, I am a spiritual person. And everything you were saying at its core is consistent with my worldview. I believe when it comes to crises like the ones we're experiencing right now, that it's really a shame when psychologists and people who identify as scientists completely discount religion and spirituality and the importance of feeling connected to something bigger than oneself. And my biggest concern about psychology is, and specifically my field, clinical psychology, is that it does often, traditionally at least, historically, take a really individualistic and disease-based framework in talking about mental health and mental illness or mental disorders. And part of why I was drawn to study cultural factors and social factors is based on my idea and my strong conviction that often human suffering is an understandable response to truly tough circumstances in the world. And it can provide so much hope and a sense of purpose and meaning, and connection to other people and to a higher power if people do feel that sense of spirituality. And for people on the call who identify as atheists, as at one time in my life I did, I think it's still really important to think about beyond, the hustle and bustle and just challenges of your life and life in the pandemic and the stress of college courses and the stress of social interactions and sexual relationships in a college context, like stepping back from just the day-to-day things you do during the pandemic or in general. What at your core is most important to you? What do you want your life to look like? And as a psychologist, Marsha Linehan says, she developed a type of therapy called dialectical behavior therapy. And she's very upfront about her own history of serious mental illness and how it drove her to develop this therapy. And she borrowed from many Eastern religious traditions primarily, but many spiritual and religious traditions in asking a core question to her patients of what is a life worth living to you? And she worked specifically with people with serious suicidality. And she would ask, what would it take for life to be worth living? And I think for many people, spirituality can make life worth living. Whatever your beliefs, figuring out, what would it look like to align the way you live your life with how you want to live your life to feel deeply at peace. And I also just want to amplify what Dr. Kinghorn said about talking about mental health struggles. Once I started opening up to colleagues and friends and family about how I had struggled with, the sadness and loneliness that Dr. Kinghorn mentioned as being common, not just during the pandemic, but over the last few years, but beyond that I've struggled with symptoms of depression, I found that the majority of people I opened up to had also quietly struggled. And the most therapeutic thing, in addition to seeking professional help, was learning that I'm not alone and talking about this openly. So many people, you can see in those statistics, those aren't just numbers, those are real people suffering. And to the extent you can open up about your experiences and allow others to open up to you without judgment, but with an open heart, I think that is incredibly important. And from my worldview, my only concern about organized religion is when it is a source of shame or ostracism for people. But when it is a source of community and healing and a sense of a higher power and a purpose for living, I think that's really beautiful and wonderful.
Thank you very much. Really enjoyed hearing your perspective. Warren, were you about to say something in response?
No, just to express thanks for that.
Yes, thank you so much, Sophie, for sharing that as well.
Yeah, both of you, yeah.
One of the kind of parts of this is we really wanted to hear questions from the audience. And one of the initial questions I thought really transitions well from what we were just discussing. And one member of the audience wanted to know if there was a distinction between religiosity and spirituality. And I think to kind of relate it back to what both of you are talking more about, do you see one or both of those playing a role in mental health? So, more than just could we define them differently, but how do you see religiosity and spirituality maybe playing a different or similar role in mental health? Sophie, do you want to take this one first?
I'll respond to part of it. I definitely want to hear what Warren has to say about this. My answer is my personal answer. It's not, I don't know, I truly don't know what the answer is from a Christian perspective. When I say I'm spiritual and not religious, what I mean is there's no one organized religion, although I have learned about many different religious faiths. Many members of my family have been theologians, have been pastors. I have both Christian and Jewish roots in my family tree. And I did go to a Quaker high school and have attended Unitarian Universalist church services, as well as many Christian services from different faiths within Christianity. I haven't found an organized religion that speaks to my full set of values and beliefs, such that I'm motivated to regularly attend services. But I have my own spiritual practice, which is primarily grounded in connecting with nature on a regular basis. And there's a long tradition of that in my family as well. So for me, disconnecting from screens, disconnecting from work stress. My work is very important to me, but at the end of the day, it's not the most important thing in my life. I need to be connected to nature to feel a sense of the world being much bigger than the world I'm currently living through my screen. And my spiritual beliefs also encompass passion for social justice and for really reckoning with my own privilege and trying to figure out how I can best give back based on the privileges I hold, which has both spiritual roots for me and a number of other roots.
Thank you. Thank you. And just to kind of also put this into framework, one of the next question that I'm going to pose to you is about the issues of social media and that relating to mental health more specifically. So I'm really glad you talked more about screens, but I want to give Dr. Kinghorn a chance to respond as well about religiosity, spirituality, and mental health.
Yeah, I appreciate that. I'll answer a little bit more abstractly about the kind of the concepts that in the medical literature or psychological literature, there's always this distinction between religion and spirituality, where religion is defined as like organized practices and rituals and community practices, and spirituality is usually defined in a more personal, often fairly individual way, like an individual search for the transcendent or for meaning or for purpose. That doesn't mean that those who identify as spiritual necessarily think of it individualistically. I'm not hearing that in what you're saying, Sophie, but I think that in the literature, that's often how it's framed. And then that often comes along with the idea of like spirituality good, organized religion bad, like that can happen as well in some of the literature. And the religion and spirituality and health literature shows that both intrinsic spirituality, when it's defined individually and in terms of meaning and purpose and connection and transcendence, and things that would clearly fall into the religiosity category, so religious service attendance, personal religious rituals like prayer, have associations with mental health outcomes, especially with depression and anxiety, that are more often than not aligned with positive mental health outcomes, but not always. And so, it's a complex literature and it depends on how you define things. And the concepts themselves are historically kind of complicated because the concept of spirituality itself, the word itself has a root that draws initially from Christian theological thought about spirituality as the life engendered by the Holy Spirit. And then you had spirituality in the 1500s and 1600s that began to be defined as kind of separate realm of religious practice that had to do with pursuing certain kinds of practices of self-discipline. And then that gave rise in our modern time to spirituality as something that's largely seen as disconnected from any specific religious practice. And so I think there's a history to it that I think makes it complicated. I just want to say that for some people, spirituality is different from religion. For some people, spirituality doesn't make any sense apart from particular religious community. For some people, they're all bound together. So to Sophie's point at the beginning, like you just can't ever assume. You have to just talk to people individually and think about what's individually, what do people mean when they use those words, and that's important.
Thank you.
Sorry, that felt like a too academic answer. I didn't mean to go quite that, but yeah.
That's exactly what this discussion is, though. Everyone's bringing in their different perspectives on the different questions that we have.
Yeah.
So one of the other questions, we've gotten a couple questions about this. I'm going to kind of summarize them and say some participants are curious about social media. Does it help us? Does it possibly help us stay better connected during the pandemic? Or does it make us more lonely? I think, would you be willing to kind of weigh some of the pros and cons, what you've seen in your own research and what you've observed and your clients with relation to those two? And Sophie, I know this directly connects to your research. So do you want to?
Yeah, absolutely. My answer is yes and yes. It can make people feel more connected during the pandemic. It can make people feel more lonely during the pandemic and in general. And this is a question I get asked a lot. I get asked by college students, by teens, and by parents. And really, I mean, social media is so many different things. Right now, what we're doing is technically social media. We're interacting with each other through technology in a social way. And I would say, this is an example of connecting. We're not just superficially browsing through each other's profiles. We're connecting and having a real discussion. And during the pandemic, my research suggests, and anecdotally from talking to young adults, I can say that there are many people who feel that social media has been their lifeline, that the ability to communicate and to see the faces, even through video chat, of people who we can't see in person due to safety concerns during COVID is essential to well-being and mental health. But my question that I pose to each of you listening is, when you use social media, are you more often using it for social connection and relationships? Or are you using it for validation, status, or social comparison? Because what my research suggests is that when adolescents and young adults use social media, sometimes they're using it in ways that don't actually deepen, strengthen, or maintain relationships. If you're using it as a way to perform your best self, your most attractive, most glamorous life self, if you're using it to passively scroll through the accounts of other people with whom you're socially comparing, that increases loneliness, it increases depression, body image concerns is a major part of my research, anxiety, disordered eating. And so it really is all about how you use it. And I also believe that moderation is extraordinarily important, even if you're using it primarily for connection. I just feel so strongly that after a certain point, and research suggests this as well, that some social media use is not associated with mental health concerns, but excessive use, as well as those more problematic forms of use I mentioned, that does increase the risk for mental health concerns. So if you find yourself compulsively using it, finding that when you pick up your phone, your thumb just gravitates toward a specific app and you didn't even realize you were doing it. And the test is, if you temporarily for one day disable that app, and then you find yourself going for the phantom app, that's how many people I work with have learned this. That is not good for your mental health. And one of the things I recommend is to try removing the apps on your phone and still allow yourself to go through a good old-fashioned browser to check your social media and connect with friends and family, but to get out of that compulsive use, and also get your phone out of your bedroom. If you need it in the event of emergency, you can put it on Do Not Disturb so that someone can call you twice to reach you. Do not have notifications going throughout the night. The blue light and the noise disrupt sleep, and I have colleagues who have really focused their research on that. So that was a very long answer because this is my favorite thing to talk about. I will simmer down and turn it back to you all, but this is something where if people want to talk in the breakout rooms, I can give you more examples of the positive and negative ways to use social media during this time.
Excellent. And thank you so much for those tangible how-tos, things that we can try. I'm going to try the deleting the app after we're done with this forum. I think that's a great idea.
Awesome.
Yeah. Dr. Kinghorn, did you have want to comment on this question or topic?
No, this is something I care about as well, and I'm glad to learn from Sophie. Yeah, thanks.
Cool.
So I think some of the participants were also kind of curious. This kind of relates to hope. So what can we do? We're talking about mental health difficulties and increasing levels over COVID during the pandemic. Do you have any advice on how we can approach this from as a UD community, or do we have any hope of sort of stemming the tide, these increasing trends that we're seeing in people just having increasing numbers of mental health concerns? Dr. Kinghorn, maybe you could kind of speak to this first and then give it to Sophie.
It's it's a really good question, and I think that the overall narrative is that so far, I think we have not seen a kind of dramatic turning of the tide in this worsening of psychological stress and suffering among college and university students in the last several years. And so I think that is something that I think is still to be determined. I think I want to hear Sophie's thought from here based on her research. My sense from as a clinician and also as a teacher, not as someone who researches this specifically, I would first of all just want to see the both end of it, that a lot of students are struggling, including a lot of you on this call, and that is absolutely valid. And there's others that are not, and that's also valid. And so I think holding both of those together is important. It seems to me that if we collectively expect, if I at Duke, as a faculty member at Duke, expect Duke's counseling and psychological services team that provides student mental health and Duke's wellness center that does like wellness programs for students to be to be those that are responsible for turning this tide and for enacting student wellness. And I think that is just asking too much of a group of people that are working incredibly hard and at an incredibly high level, but don't have the ability to do what we're asking them to do. I think it actually is going to require communities of students, and also I think communities of faculty, as faculty work with students, to think about what does it mean, not maybe for all of UD, unless you're the president or something, but what does it mean for you in your immediate relationships and in your classes and in your major and in your fraternity, sorority, or religious group or athletic team or whatever, to think about what are ways that people can be known by each other in healthy, appropriate ways. What are ways that people can listen to each other to meet each other's needs? What are appropriate expectations for the ways that we live together and for what we expect of ourselves in terms of performance? And goodness, anything that any college campus can do to reduce the rate of sexual assault and sexual violence on college campuses on an annual basis will make an enormous difference in the lives and sometimes life and death situations of students. And so I think committing, the very minimum, committing to how can we work to prevent sexual assault and sexual violence on campuses, and that itself would be really huge.
Thank you so much. And I'm sorry, Dr. Choukas-Bradley, I referred to you as Sophie.
No, I prefer you both refer to me as Sophie. We've all been going back and forth with the different names, so that is totally fine.
What are your perspectives on this? I know you have a lot of great ideas and perspectives on this. Can you share with us?
Absolutely. I mean, I 100% agree with what you've shared, Warren. And I was going to raise a similar kind of main point about figuring out for all of us, for the three of us, for everyone on this call, none of us, well, maybe the president of the university is on the call. I don't think so, but assuming none of us have an enormous sphere of influence, what is yours? What is your individual sphere of influence? What I mean by that is, for example, I'm a brand new junior faculty member. By junior, I mean I don't have tenure, and it would not be appropriate for me to try to control, my entire department's climate around mental health, or to try to blast messages out to the entire university. But I have a lab. I have graduate students, staff, undergraduate students who come together weekly. And so I can decide, for example, with the most recent police shooting, I can make the decision to send out a message of support and resources to the people I feel comfortable doing that with. Within my department, I've been exploring ways I can make a difference, even though I'm brand new, and both Philip and I were, well, I guess you joined right before COVID. Is that
just
right?
about the same time you did.
Yeah. Okay. Yeah. So, we've never, I live basically on campus, but I've never set foot in the building or gotten to know any of my colleagues in person. But I've tried to figure out what are the things I can do. Okay. I can come up with a guide to how grad students can seek psychotherapy under their insurance plan. So I did that. I can join the University Pride Caucus and figure out how I can connect with other members of the UD queer community and offer support to other queer folks. I can engage in anti-racist action at the department level and the university level and learn how to be a better white anti-racist ally. And if you can figure out in your sphere of influence things you can do to provide emotional support, so just being there, being a listening ear for someone, instrumental support, can you help out someone in a really tangible way, like helping them out with their schoolwork if you're in the same class and they're struggling more than you? And then can you figure out more community oriented, social justice oriented, whether in the context of your religious community or more broadly, ways of helping on a broader level? Helping other people connects us to one another and can make an individual feel much better about their own suffering if through the suffering they can still be there for others. And I think for any faculty on the call, I do think it is really, really important to directly acknowledge at the beginning of every course that students are struggling, and to directly provide resources and directly acknowledge that some of this suffering may affect schoolwork, and to have flexible policies that meet the unique needs of our time. Whether somebody is struggling with access to technology during the pandemic in their home environment, they have housing insecurity, if they're devastated by experiences of racism directly or indirectly experienced, whatever the suffering is, to acknowledge it and to show humanity. And going back to our original point, seeing other people as human beings and not machines. So I do think, for all of us thinking individually about our direct interpersonal relationships, our slightly bigger spheres of influence, and then our community spheres, is a really important starting point. And I know I've been talking a long time, but I want to make one other point, which is that most of us, including myself, can identify at least one COVID silver lining, something you've gained through this experience of living your life differently for a full year. For me, I've rediscovered a deep passion for reading and decided that part of living a values aligned life would be to set the goal of reading 100 books during 2020. And then when I met that goal, I reinstated it in 2021. I don't have kids yet, so I do have a lot more time than some folks on the call might have. But for me, reading is a way of learning about the world, getting out of my own head and my own individual experience, and expanding my boundaries. And I also rediscovered my love of walking and that connection with nature I mentioned. And I realized how much I had neglected that as a faculty member, just running from one thing to another. And so, those are minor examples. You might have had a more profound experience. You might have had a loss that really changed the way you view the world. But think about, for you, how has this pandemic changed you? And can you hold on to a part of the positive change or the positive lesson you've learned and take it forward into your life after the pandemic?
Excellent advice. Yes, I think that'll be something I also process after we get off of this call. So thank you. Yeah. I feel like we've got about 10 more minutes, and I think there's a couple questions that we can kind of wrap into one, so that we've got responses from both of you to hear about really addressing these issues of mental health from different platforms. So one question's more about advice about addressing mental health issues with friends, like creating friendships that confront these issues more directly instead of leaving them unsaid. But then from the same experience, we have a number of student leaders on the call, and we've got faculty that are joining us on this call. Do you see their roles as being different in those kinds of settings, as a leader role and as a faculty role? So maybe if you're willing to speak to kind of ways that we can address mental health from both a peer perspective and also as sort of a leader or faculty perspective. And I'm not going to choose who wants to go for this first. I'll let you guys decide what you'd like to say or who would like to speak up.
I'd love for Sophie to talk about the peer perspective because it's closer to her immediate research. And I also would like to hear what she does with the faculty perspective, but I would just recognizing that there's a diversity of different people in different stages of career and training on the call. Maybe specifically speaking to faculty, and I don't know how many faculty are on the call tonight, but I think it's, and this is also said in the overhearing of students. So students, I think, need to know that faculty also struggle, and faculty need to acknowledge that we also struggle. And it's really hard sometimes to acknowledge that when, like, you're the professor and you're supposed to be, like, in charge. And I think that I mentioned shame, but I think that the process of doing a PhD and competing for academic jobs and then getting promoted in academic positions, it absolutely cultivates shame regularly, and actually, is a pretty strong motivator. And I think faculty can get so burdened by shame that it just eats at us. And I think that students need to be aware of that, but faculty really need to be aware of that in a major way, and get our own support, do our own work, and be able to talk about that and to cultivate departments where that can be talked about, which is not maybe that common. And I think that's really important. I think also for faculty who want to engage these questions, I just want to echo what Sophie said, that faculty to do a PhD, or in my case an MD and other doctoral work, is like you've gotten good at kind of controlling yourself and the world around you with words and data and facts and that kind of thing. And so often that process causes us to be kind of distant from ourselves and to think like we have a certain subject matter that we're distant from. But when students come into a classroom, and those of you that are students know this, like we bring our whole selves in, and faculty bring their whole selves in, and there's a meeting of human beings, and that can get complicated and messy. And I just think it really helps when, as Sophie just said, when faculty or graduate student teaching assistants or others just acknowledge what's in the room and speak with. So talking about systemic racism is really hard, no matter who's in the room, but different people who've lived different life experiences are going to hear stories and interpret things in different ways. And so always thinking about what are the memories and the stories that are brought into any room, and acknowledging that up front, trying to make that as clear as possible in the way that we speak with each other. I think that leads to healthier communities. I think it leads to more consideration of who we are as human beings. I think it actually improves learning also, because if people aren't in a situation where they feel sufficiently known and safe and secure to be able to be vulnerable to some degree, even if it's just vulnerable to taking in new information, then learning is going to be really hard. And so I think we have a role to play in that. And I would just say, as a Christian, I believe strongly that we ought to really strive to do that, and to learn from others who are doing it well, and to strive to exercise it ourselves.
Thank you. Great perspective on that. I appreciate that.
Yeah, Sophie? That was, really beautifully said. Yeah, I think what I'm hearing from many students is a sense of not feeling seen and heard, and not feeling like their pain is being acknowledged. And at an individual faculty level, providing that humanity to students and offering that support. I mean, it is tricky. So for example, I'm a licensed psychologist, so I actually can't get into a therapeutic role with my students. So I have to draw firm boundaries of offering a basic level of support, but then connecting students to services rather than serving in a therapeutic role. But when faculty just acknowledge what's happening, and to the extent faculty feel comfortable, as you were saying, Warren, disclosing our own struggles, this is not easy. I don't know how many graduate students are on the call. I've noticed one faculty member's name who I recognize, and haven't seen any grad students, but if you are a graduate student on this call, I know there can be this culture in academia of needing to show no weakness, and needing to display an ability to work around the clock no matter what is happening in the world. And again, thinking about sphere of influence, I've tried to model the exact opposite of that throughout the pandemic to my students. When one of my graduate students was expressing a desire to distract from the pandemic with work, I questioned that and said, what would it be like to find another way to distract yourself and take care of yourself, so that if this pandemic brings personal trauma, you're ready to face it. And I do think for undergraduate students as well, if this rings true for you, if you found yourself coping with the distress of the pandemic or with racism or other things by just working and throwing yourself into classes, are you leaving the space to take care of yourself and to be ready for what life might throw at you? And are you leaving the space to have community and real connection with others, and to be vulnerable with others? And with regard to the peers piece, during the college years, your relationships with your friends, your relationships with your romantic partners, if applicable, are extraordinarily important. Fights with friends in the college years have much more of an emotional impact, according to research, than fights with friends later in life, when a partner or one's children might be, the primary attachment figures, to refer to one branch of psychology. But right now, you might find that the people you rely on most and who rely on you most are people your age, potentially if you're a UD student, other students at UD. And so this brings up two kind of paradoxical ideas. One is that you can make a huge difference by being a source of support and love for your friends and romantic partners or sexual partners, if applicable. And it is not your responsibility to take care of somebody who's experiencing severe distress. In that case, sometimes students will feel like they have to, be the person who's making sure someone is not imminently about to harm themselves, for example. And when you're at that point, it's really important to seek support for your friend and for yourself, because if you don't have training in that, it can sometimes cause more harm, certainly to you and possibly to your friend as well, if you're trying to take on that heavy weight. And so think about what you need to provide that support without becoming somebody else's, number one lifeline, or is serving in a therapist role. There are resources and supports for you here to go to. So I'll pause there in light of the time. Warren, I was curious if you had any follow-up thoughts to that piece.
No, I just agree about, I just agree about the support part. And I think that, that we could spend a whole session talking about recognizing and preventing and responding to suicide and thoughts of suicide. But I think that, one, just to name, as we said, as we have, and I think we're going to say this again, that that if any of you on the call are contemplating suicide or are having these thoughts, as many do on college campuses, then absolutely find someone to tell about that and to talk with about it. And I think for those of you that are supporting people who are disclosing thoughts of suicide or other things, it's really important to hear and to listen and to respond, and then to make sure that that the person whom you love is cared for by a broader network of people who really are capable of providing that care. And I think some confidences are just too heavy to carry alone for a long period of time. And so the question then is like, how can I work with you to get you to the place and the help that you need, so that you can be so that we can get through this together. And I think that is just really important for all of us to kind of draw on a network of a community and not take things on just ourselves, either in support or just trying to power through our own personal struggles.
Absolutely. And I'm just going to add one other thing. I know we're over time, but I want to add, for anyone, no matter what okay, if we're talking about a lower level of distress than suicidality. So if you're trying to offer support to someone who is feeling anxious or down or lonely, one thing that we learn as psychologists and psychiatrists is the value of active listening, not trying to problem solve for the person you love, but hearing them and reflecting what they're saying and trying to hear their feelings and let them know you hear their feelings. And most of my clinical experience is actually not with adolescents and young adults, but with couples. And the number one thing we can teach to couples is, when one partner is distressed, teaching the other one how to listen without trying to fix the problem. So while all of us are so motivated to figure out how can we turn a corner and fix this mental health crisis, it starts at the local level of being there for each other as active listeners with open hearts, rather than there being a magic wand solution, which I wish there was. But we can start with these forms of social support in each of our relationships and lives.